Over the course of the past 10 years, healthcare and healthcare reform has been the topic of conversation in many circles. There have been public debates about it, politicians have run for election based on it, divisions in communities have been created by it, however, no solutions have been found for it. You see, for me, it was during a trip to the emergency room with my daughter last year, when I observed a small group of nurses at the desk. They were looking at pictures on a phone, laughing, and talking about the vacation one of them had just returned from. When a lady walked up to the desk and asked for a glass of water for her mother, the nurse turned and looked at her irritably. I want you to pause right there for just a moment. I want you to reflect back to a time that you or a loved one was at the hospital and asked for something, and you received that death stare. That was the look she gave this woman while she gave the generic response of, "I will look and see." The lady humbly thanked her and walked to her room. You see, throughout my visit up to this point, I had noticed there was only one CNA rounding on all these rooms. And what I witnessed in the next few moments set me into a different mindset regarding health reform. The nurse being too busy with her coworkers discussing the vacation, called the lone CNA to the desk. I could see past the desk down the hall where the CNA came out of the patient's room, walked to the desk, only to be asked to take water directly across the hall. I was floored. I was flabbergasted. You can imagine the thoughts and the names that ran through my head. I hadn't seen the nurse even check to see if the patient could have water. Beyond the possible medical errors that could have taken place, the look on the aide's face when she walked away was a look of defeat. The aide, without thought, took water graciously into the next room before coming to check on my daughter. When she came in, I noticed her demeanor had changed from earlier, when we first arrived. When I asked her if she was okay, she explained she was just ready to go home. She began to explain that she was the only aide with 6 nurses. She stated that she felt overworked and stressed but needed the job. She explained that she felt bad because one of her patients had choked on some water she gave her. That she needed a thickener in it and she had no idea. As she began to cry, she said she was going to quit because her department lacked leadership. It was at that moment I learned to ensure positive change, healthcare providers must first learn to lead. I found myself asking the question, can servant leadership save the healthcare community? Many believe that the current healthcare system is broken and unsustainable. The healthcare system is faced with the challenge of increased cost. I believe Fieldstein said it best when he said the nation's inability to deal successfully with the problems of the healthcare sector, particularly rising cost and maldistribution of health services, reflects in part an inadequate understanding of economic behavior. All of this while having a decrease in the quality of nursing care, high turnover, and increased medical errors. And this domino effect has created an environment of growing pressure from the politicians as they have heard the demands of the patients and the general public for a better healthcare value. Aiken brought to light something I considered to be common sense when he said reducing nurse burnout may be an effective strategy for improving nurse-rated quality care in hospitals. You think maybe burnout has something to do with the care being received in hospitals? Knowing there are several changes that need to be made within healthcare community, leadership should be at the front line, as it could affect change to the core issues. The traditional healthcare leadership styles have seemingly failed, and the results are demonstrated by increased medical errors and organizational failures. Job satisfaction has been linked to turnover and quality of care. Research shows that job satisfaction drops when institutions fail to develop teamwork. Lack of effective leadership directly correlates with burnout and job dissatisfaction. Former president of the Greenleaf Center for Servant Leadership, Larry Spears, stated the 10 most important characteristics of servant leader has to be listening, empathy, healing, awareness, persuasion, foresight, and a commitment to the growth of people building community. When the servant leader is actively listening to the needs of the staff and helping to support them in their decision making, a trust begins to form. And while seeking first to understand the needs of the others and empathize with them, if he or she helps the staff to resolve their problems, negotiate their conflicts, and encourage the formation of a healing environment, then, and only then, will organizations begin to see cohesive teams. In the age of healthcare reform, healthcare providers must improve. To ensure a positive change, healthcare providers must first learn how to effectively lead staff, eliminating nurse burnout, slowing turnover while reducing medical errors, thereby shrinking medical costs. I want you to take a moment, and I want you to stand and look in the mirror. And I want you to ask yourself one question. Is there a servant leader within you?